Hello everybody, welcome to this video. This is a video on effusions, specifically benign elements of those effusions, and this is adapted from Sebas and his cytology textbook. So first of all here, let me move this over here. So essentially when we think about effusions, there are different types of effusions. So we think about three main types of effusions: pericardial effusions, which are kind of more rare in terms of cytology specimens, and then also we think about pleural effusions, which can be quite common. A lot of patients end up getting thoracentesis procedures while being hospitalized, depending on what kind of process they have. In medical school, of course, we learn about Light's criteria and transidative versus exudative effusions, so that can also be helpful in evaluating what's going on with the effusion microscopically. So the first, and then also in addition to pleural fluids, we have acidic fluids, and then those can be because of conditions like cirrhosis, but it could also be from malignant processes as well, some sort of ovarian malignancy, things of that nature. And then so those are the main effusions that we encounter in clinical practice. So once the proceduralist, whoever is doing it, does the procedure, whether it's a thoracentesis, paracentesis, or pericardiocentesis, then that fluid essentially gets kind of spun down and it gets stained and read by a cytologist and a cytotech and cytologist. I don't know if that's a word. Pathologist who specializes in cytology. So the first thing that we're going to look for then is mesothelial cells. Mesothelial cells, I think originally they look kind of scary because they're kind of large and they have this kind of oddly placed nucleus. But usually for those, if you look at the benign mesothelial cells, what they'll have is they can classically have like a lacy skirt pattern, and then they're going to have like, maybe I didn't depict this as appropriately here in this drawing, but they're going to have like smooth nuclear contours, and then they're also going to have these little windows in between the mesothelial cells. So the windows and lacy skirts, especially the windows, are kind of a good marker to look for when you're trying to assess whether or not it's a benign mesothelial cell. You can also have reactive mesothelial cells, so these are going to be a little bit more enlarged. They're going to have large hyperchromatic nuclei, so again, have to be careful with these and not assume that it's some sort of malignant process when it's just a reactive process. And then lastly, we have histiocytes. So histiocytes are going to be seen in anything really, but the most particular finding for histiocytes that in terms of fluids is I associate with like pericardial fluids. If there's something going on in the pericardial fluid, then you'll see these histiocytes there, and that's what's in the textbook as well. So for histiocytes, these are going to be oval or have oval or folded nuclei, so it's kind of their characteristic feature. So that helps you determine what the histiocyte is and what it looks like and what's going on with the patient. So I hope that this helps. A really short video, but just trying to help you sort of slowly introduce yourself to effusions and then what sort of cells you'll commonly look for. Thank you.